Hello there, and welcome to your first at-home lecture in a while. So Unit 13, I told you guys, is going to be a relatively short unit. We just got done with abnormal psychology, and now we're going to be looking at how do we treat psychological disorder. So once it has been diagnosed and someone goes for treatment of it, there's a couple different ways. So do we just take medication? Do we go to therapy? What is the combination of them? So your unit overview, I told you have 4 notes. We're going to talk about the psychological therapies, how we evaluate them. So your psychological therapies are broken into 2. You need to know these. So psychological therapies are separated into 2. We have the psychotherapists, and can be considered like a therapist. So psychotherapists are people that cannot prescribe medications. The biomedical therapies are going to be anything that involve medicine or physical treatments. Okay, so our psychological therapies are broken into the psychological are going to be the psychotherapies, and then the biomed theories. And then we're going to talk about how we prevent psychological disorders. So 4 different lectures. Today we're going to be talking about just 2 different types of our psychotherapies. All right. So let's start out with the history of treatment. Before there was ethical treatment of psychological disorders, there's a whole bunch of bad things that happened to people that were something was wrong with them. So things like lobotomies, so portions of your brain being removed if you were thought to have some type of disease of the brain, that you were possessed, right? So beating the devil out of people if there was something wrong with them. So in the early 1940s, these 2 psychologists, so Pinnell and Dorothy Dix, were kind of the first people that came along and with these ethical guidelines of treating psychological disorders. So those are just 2 names that you need to know for early so I'm going to say therapy. Okay, so psychotherapy, I told you we're going to talk about 2 of them today. Today we're going to focus on psychoanalytical and humanistic, and in our next notes we'll look at behavioral and cognitive. So there's major theories of types of therapy. So my psychoanalytical, we're going to have some notes on this today, but psychoanalytical is more like Freudian, talking about like past issues and regression and things that you didn't deal with as a child that are somehow manifesting in your current situation. Humanistic, that's Rogers. We talked about him at the beginning of the year, looking at like just listening and being humane with people. And then behavioral is going to be our type of like training with, oh gosh, I can't think right now. Operant, sorry, couldn't think of that word. Our operant conditioning, right? So trying to come out a psychological disorder with training someone not to feel that way anymore. And then cognitive is going to be our thinking. All 4 of these types of therapies can be done one-on-one or in group sessions. And most, over half of the therapists today use what's called the eclectic approach, meaning that they aren't just psychoanalytical or humanistic or cognitive or behavioral. They're kind of this combination of both. So eclectic means like a blend of all the different types of therapies. All right, so an eclectic approach would mean that you blend the 4 different psychotherapies depending on the patient, depending on the situation. So let's talk about those 2 today. We're going to start out with our psychoanalysis. Remember, psychoanalysis is our Freud. We will talk a little bit more about him next week with personality and the different stages of Freudian. So when I mentioned Freud in this lecture, or even at the beginning of the year, we called him like Freud the freak, meaning that he has these interesting stages that he thinks define your personality, that if you never get over them, if you get stuck in the like anal or oral phase, that like you never particularly grow out of it. So Freud, though, is our first therapist that was really of the psychological therapies, where this was his office, where we lay on the couch and you do the free association, and I'll talk about that in a little bit, but it's more just talking to your therapist. There's not face-to-face, sorry, I hit my computer, not face-to-face interaction, but the person is facing this way, the doctor's behind them, and they're more just thinking aloud. And the aim of this therapy of psychoanalysis was really to get rid of those conflicts that still existed from childhood, or the impulses that existed from childhood. So psychoanalysis, Freud was looking at past things in your childhood that you never resolved that you're looking to resolve now. And that could explain a whole bunch of different things: anxiety, depression, schizophrenia. So all these things were rooted in some type of childhood trauma that you never got over. So the methods of psychoanalysis, the free association, that's what I just mentioned. So free association is kind of where the person is, this is free association, lying on the couch and just talking, right? So just talking aloud and like, what does this remind you of? What do you think of when you say mother? And what the therapist's job was to notice any places of resistance. So I didn't type this all in. So they were supposed to notice anything when you're talking that made you anxious. What did you not want to talk about? Because that would be the therapist's job to kind of work through those things that you avoided. So resistance is any time during that free association where the therapist noticed anxiety. And then it was also the job of the therapist to interpret the meaning of things. So we talked about Freud and dream analysis, and he was the one that talked about the latent content. So the manifest is what happened, the latent's kind of like what's left behind. Looking at the interpretation of the meanings of your dreams and your emotions or your connections to things. Okay, and then transference, this is all under psychoanalysis. Transference was any time the patient would transfer the emotions of past into other relationships. So transference was the analysis of the emotions and then transferring onto a current situation. So the reasons why you have troubles with your boyfriend now is because of daddy issues when you were younger. So those are transfers. So these are all, just to kind of back up, all under methods of psychoanalysis, the free associations, the therapist's job to notice resistance, interpretation, and transfers, all associated with the thinking aloud process. Okay, in class, I want you guys just to copy this down. We're going to compare and contrast the psychoanalysis with the psychodynamic. I know they all start with psycho, right? So we'll have to talk about some type of acronym, mnemonic devices on how to separate those. So the psychodynamic therapy is different from psychoanalysis, and that it aims on self-insight, not necessarily things that happened in the past, but it's looking for insight into maybe why you act the way you do, or you have the thoughts that you do, not so much basing things on the past. So what I'd like you guys to do, and we'll talk about that more in class, is I want you to make a chart between psychodynamic and psychoanalysis and just leave it blank. So we'll look at some similarities with psychoanalysis between psychodynamic, and then what makes them different. So how are we going to figure out the difference between the two? Okay, so that's psychoanalysis theory. Now we're going to look at the humanistic therapy. Remember, this is Rogers. So the humanistic therapy really focused on something called insight. And this is humanistic, remember, is kind of like your feel-good type of psychology. So it's going to focus on 4 things that make it very different from psychoanalysis. It focuses on the present versus the past. So Freud was all about the past and things that you had not resolved. Humanistic or insight therapy focuses on the present. What can we do with it now? It focuses on the conscious versus the unconscious. So remember, our dreams, or sometimes, or Freud would talk about these things that happen unconsciously, our super ego and our ego, things that we're not aware of. Humanistic insight therapy is going to focus on the things that we are aware of. Not necessarily the things that happen in our dreams. Taking immediate responsibility instead of blaming past, and then promoting growth instead of curing. This is a big one. So humanistic insight therapy does not aim to cure anxiety or depression or whatever disorder that you are in there getting help for, but rather to promote growth and figure out how to grow through the disorder, not necessarily to cure it. Moving on with humanistic therapy, it's very client-centered, and I put Rogers there just because I mentioned him earlier, and you need to know that Carl Rogers was our big guy here. Oh, this is kind of all over the place. Let's move this here. All right, so client-centered therapy, meaning that the client was the middle, and the therapist does very little interaction with the person. non-directive therapy, they listen without interpretation. So instead of trying to give meaning to what you just spoke aloud, they're just more aimed at listening. Also with a very genuine, accepting, and empathetic mentality, meaning that they're not looking to explain why you are the way you are. They're just there to hear you talk. More of this goes on with, instead of, what I want to say, where you're not face to face, where they're lying on the couch and the therapist is behind. Humanistic insight therapy happens more one-on-one, like a conversation with like a really good listener. So client-centered therapy and humanistic practice active listening. Active listening we actually talked about in class, and we've practiced some of these things. So paraphrasing back what the person just said. So what I hear you saying is this. Invite clarification, meaning that if you're confused on something the person just said, then you say, can you explain a little bit more about this? And then reflect on the feelings. So what you're saying is that you feel angry when your dad does this. So reflecting on the feelings rather than the actions. Okay, so take all of these and move them back up here. So genuine, accepting, empathy, more of just a really good conversation. And then humanistic, judgmental, wrong. Oh, it's not gonna, there we go. Humanistic, again, remember that kind of feel-good love hippie was really with an unconditional positive regard, meaning that no matter what, there's a caring, accepting, non-judgmental philosophy behind the therapy. All right, so those are our two that we're going to cover today. So Rogers and Freud, looking at psychoanalysis and humanistic. Tomorrow night's lecture, we're going to look at behavioral therapies, going back to Skinner, and looking at operant conditioning and those types of things. Make sure you have that blank box where in class we'll compare the two different types of therapies and know the names and the vocab for this section. Have a good night.